Global Health Solutions present HeartQuest HRV as a functional assessment tool for research and education purpose only. So today topics we will be covering circadian rhythms and a daily forecast. So what's meanings of the circadian rhythms? It's often referred as a body clock. The circadian rhythm is a cycle what's to tell our body when to sleep, rise, eat, regulating many physiological processes. This internal body clock is affected by environmental, sunlight, temperature, and other chemical reactions what's going on. Why the circadian rhythm is important? So circadian rhythm can be influencing the sleep-awake cycle, hormonal release, eating habit, digestion, body temperature, and other important the body function. Circadian rhythm is understand, so it's a first step for the better sleep. Your circadian rhythm, known as a sleep-awake cycle, so the body clock, is a natural. Internal system is designed to regulate feeling of sleepiness and awakeness over 24 hours period of time. Example of the circadian rhythm is like sleep-awake cycle, the body temperature regulation, and hormonal secretion. The endocrine organs which is involved in regulating the circadian rhythm is a pineal gland, or it's called a third eye. So the pineal gland is located in the central of the brain and producing melatonin, which is affecting the circadian rhythm and regulating reproductive hormones. Sometimes we heard people telling about other people, so they are for example, a lark, early bird, or morning person, or in opposite, which is kind of like a night owl, evening person, or simply owl. So let's see how we can interpret and how we will see what's the difference circadian rhythm is affecting. What's the morning person? So the morning person, call it a lark, early bird, morning person, or in Scandinavian countries, so they call it a person, is a person who is usually get up early in the morning and go to the bed early in the evening. Morning person who awake without any difficulty early each morning and alert and active during the first part of the day. An opposite, which is kind of like a night person or a night owl, it's an evening person or simply owl. It's a person who tends to stay up until late at night. In the several countries, especially in the Scandinavian, early birds are called a person and a night owl are called a B person. So let's pay attention for some stuff on the daily forecast. First, we pay attention what time of the day so we see dropping or increasing. So this is very important. And the second part is like how much total energy. So when we're looking for the daily forecast, so we would like to look on the two parameters. What's the total energy and what's the timing if we see some dropping. So if, for example, if some people have 75 to the 100, usually patients do not noticing any energy drops during a day. But when they're lower than 50, so the patient can be experiencing energy drop during the day. So let's see, how do you feel during the day? If we see daily forecast is running almost like on the top, so usually these people, when you ask the question, how do you feel during the day, they say so they're the same. And so this is why, so when we're young, for example, we spend all the night in the club or a party, and then so just come home and sleep for a few hours and we can function again. With age and then so with a lot of stress, so we see so the daily forecast, so it starts dropping, and we see so some of the time of the day, so we feel less energy. So this is what a kind of like, well, example of the when it's like high and when it starts a little bit dropping. But when it's like very low, in this case, so we see like it's progressively low. So you can ask the person, I mean, like what time of the day? Is it early when you wake up? Do you feel fresh? Do you feel a lot of energy? When you go back into the sleep, So how you feel? Do you fall asleep very quickly or not? Or it's kind of like, well, people say, oh, I feel all tired all day long. So circadian rhythm will affect the sleep. So that's why they have a circadian rhythm sleep disorder. Is a family of sleep disorder affecting our body like timing of sleep. The people with a circadian rhythm sleep disorder are unable to go to sleep and awaken at the time commonly required by the work, school, or social needs. What's caused the circadian rhythm? So basically it's a various stuff is affecting. So one of them is a melatonin and a cortisol. Actually in the thyroid stimulation hormone, prolactins. So all the hormones have a circadian rhythms. So the natural sleep-awake rhythm is known as circadian rhythm. A disruption of this rhythm can be affected by the different hormones. So in this case, we will discuss melatonin and the cortisol. So let's see how we can see what part of the hormonal imbalance can be affecting. So when we're looking on the daily forecast, so we see it's kind of like, well, running low. So we would like to find out why it's affecting energy. First, we're looking for on a cortisol level. In this case, we see it's like high cortisol, high inflammatory index, and low DHEA. So this will tell us something is going on, so they will affecting the cortisol adrenal production. And another way, where you can look on energetical plexus, especially energetical plexus 1 and number 2, where we have hormones production of adrenal hormones and sex hormone production. So this will be first EP1 and EP2 maybe lower than the others stuff. So let's discuss the cortisol. So the cortisol is one of the most distinct and fascinating circadian rhythm regulator on the body. So it's usually it's like producing high amount during in the morning, and then they start slow down during the daytime, and it's helping up to synchronize all the body circadian rhythms. So the cortisol is essential steroid hormone secreted by adrenal glands, and like many other physiological processes in the body has a circadian rhythms. Like we discussed, so it's like, well, producing high amount during the morning, and then during the evening time it's supposed to be running low. So when we see that the cortisol level is high, so probably we're dealing with some inflammatory process, and the total cortisol is high, so they may be affecting the sleep pattern and affecting the circadian rhythms. So problem associating with chronic elevated cortisol level, it's suppressed immunity, hypertension, high blood pressure, insulin resistance, carbohydrate craving, metabolic syndrome, fat deposit in the face, neck and belly, reduced lipido, rapid weight gain, high blood pressure, muscle weakness, mood swings, anxiety and depression, and many other stuff. So let's switch and see how does melatonin is affecting the circadian rhythms. So for melatonin is appear two probably interacting effect on the sleep-awake cycle. The first is entertain the shift of circadian rhythm in a chronobiotic function. The second is promote sleep onset and continuity of the hypnotic function of increasing the homeostasis during the sleep. So basically it's kind of like, well, internal switch. So when the melatonin start producing, the cortisol has to be dropping, and melatonin is helping up to keep our body sleep during the night time. So how we can differentiate where we can look? So basically on energetical plexus number 7 and number 6, which is kind of like, well, a relationship to the melatonin production and the hypothalamus area. So pituitary gland. So this is where we kind of like looking. So if we see this particular, then EP7 and EP6 is lower than other one, so we may assuming probably this circadian rhythm was affected by the melatonin production. So biological rhythm control a lot of body function, including the performance, behavior, sleep, endocrine regulations, primarily regulating by circadian clocks or circadian biorhythms. So circadian biorhythms is a powerful, but people can change their sleep-awake cycle. If we're talking about changing the timing of the sleep-awake cycle, this usually takes at least 2 weeks, sometimes more. For example, if you need to get up early but haven't yet convinced your body and the mind to shut down and go to sleep early to compensate what you usually reset with 2-3 weeks. So practicing healthy sleep will be the most effective way to stimulate a melatonin production. So this is the cover for circadian rhythms. If you have more questions or would like to have some more information, you can log in into the www.hrvhq.com. And so the HeartQuest HRV is more advanced than the other HRV system on the market, and this is for the research and education purpose only. Thank you very much.